My name's Dane Dudley. I am a dentist at Lompoc Family Dental, and I want to share an interesting case in partnership with LuxCreo and Evident. We had a patient of ours that ended up in the hospital after an accident. He broke 3 teeth and completely avulsed a 4th tooth. He was referred to my office after the extractions to see if we could rehab this part of his mouth. He had limited bone available and some sinus issues, so he wanted to avoid a traditional sinus lift. This is the plan that I came up with. It's more of an all-on-X approach, but works well in avoiding the sinus and getting a good anchor in the available bone. We found a septa in the sinus that was able to get good stability for that distal implant and use an angled MUA to plan out that middle implant. Because of the angled implant, we ended up making 2 surgical guides. These were both printed on LuxCreo's 3D printer using the surgical guide resin. The implant surgery went according to plan, and we let that heal for a few months. We uncovered the implants, placed MUAs and healing caps, and then let the soft tissue heal for a month. I used an OptiSplint to take final impression of these implants. I submitted all my impressions through LuxCreo Crowd software, which has designs powered by Evident. I received the design back and was able to use LuxCreo's AI nesting software. With one click, it auto nests the design onto the build platform. I printed with Flexera Smile Ultra Plus, which is a validated resin from Desktop Health. This is what the bridge looks like directly from the printer after it was washed. The supports were then removed and polished. I added stain and glaze to make the provisional more lifelike, and this is where the benefit of that OptiSplint workflow comes into play. I was able to pour up implant analogs and use those to verify the design before ever bringing the patient back into the office. We already knew that the bridge would fit the implants, but wanted to check that the provisional fit the tissue, contacts, and occlusion. We had the design milled out of zirconia and delivered that to the patient. We sealed up those access holes, and this is the final bridge. And here's a final x-ray just to make sure everything was seated all the way.